is your favorite program, the Online Pregnancy School. My name is Dr. Linda Vanutu, and it's always a pleasure and an honor to come your way with a very interesting topic about pregnancy. You know, the goal for this program is that everybody would know about pregnancy, what we should look out for, what we should be concerned about, and why we should seek medical care anytime during the pregnancy and even after delivery. And that is why I always bring you experts on this program. Let's go for a short break. Welcome back. This program is sponsored by Promise Ghana. We are concerned about you being healthy. Vanutu International, we take care of your development. Reverse Star, if you're having a party, a wedding, or anything that will bring people together, being mindful of the COVID season that we are in now, use Reverse Star because it's hygienic. The drink will come from below and your guests will be amazed. And because we are again in the season where we have to continuously wash our hands, remember to use Bubble Gold liquid soap because that will keep your hands clean. Dear viewers, we have done so much. We've spoken a lot about pregnancy, but somewhere along the line, some women develop what we call complications in pregnancy. And this is what we want you to know about. There are some of them that are common, where everyone knows about it, but there are also others that we may not be so conversant with. And that is why today it's a delight for me to introduce my guest. My guest for today's program is a colleague, a friend, Dr. Emmanuel Srofenyo. Dr. Srofenyo is the medical director for the Greater Accra Regional Hospital, RAGE. He's also a consultant obstetrician gynecologist. You have heard this name over and over and over again. Now you know who an obstetrician gynecologist is, the woman's doctor. Doc, it's a pleasure to have you.
Indeed. It is
You're
also,
welcome.
Thank you so much. Pleasure to be in your program.
It's
Let me
indeed a
send
big
my
pleasure.
best wishes and greetings to your listeners.
Yes, we are very happy to have you.
Thank you so much.
Yes,
Thank you
I
so
know
much.
that you are going to talk about a very important.
In God's wisdom, the blood vessels in the body are under a certain pressure, which allows blood to flow through them. And so this pressure is controlled by certain forces.
Okay.
So the pressure can go a little too high or it can go low. So when the pressure goes high, that is what we call hypertension.
Okay.
And for one reason or the other, the pressures go low. We call it hypertension.
Hypotension. Some people may not have heard that before.
Yes.
They only think of hypertension.
Yes. So
But this is
these are the
hypo.
two variables.
Okay.
And then we can have normal tensive or normal tension, which means that the blood pressures are within the normal range.
What is the normal range?
The normal range is it should be somewhere between 130 or 120 for the top value to around 80. It also depends on our age. It varies depending on our age and the rest.
Okay.
And then for pregnant women, when the top one, which we call the systolic blood pressure, goes above 130, we say that it is going high.
Okay.
And then when the down one is going above 90, again we are worried.
Okay.
So these are the normal ranges.
Okay. Dear viewers, you have heard about normal. Normal is normal. Hypo is low, hyper is high, and then you add the tension. So that is what we're going to talk about today. And we're going to look at the hypertension that occurs in pregnant women. Doc, isn't every pregnant woman who will develop hypertension?
Not at all. It is not every pregnant woman who develops hypertension. It is something that happens to some pregnant women. And we do know the question will be what will cause some pregnant women to develop the hypertension. The fact of the matter is that this is an area that has engaged researchers for years, and up to date, we don't know the exact cause, the exact reason why some pregnant women develop hypertension in pregnancy and why some of them do not develop it. Even though we don't know the exact cause of the condition, we do know the risk factors.
The risk factors.
The risk factors. The reason why some people are more prone to develop it, we do know. So we don't know the cause, but we know the risk factors.
And what are some of these?
Yes. So some of the risk factors are extremes of age. When you get pregnant, in extremes of age, very young girls. And let's say you are just about 15, 16 years and you achieve pregnancy, you are at the high risk.
Now that we have known the various types, what are the signs and symptoms?
Thank you very much. So we are now getting to the more interesting parts of the discussion. But most of the time, this disease can occur to a woman without showing any sign.
She wouldn't know.
She wouldn't know that her blood pressure has gone up. And even for people who are not pregnant, for the average individual, this is one thing about hypertension that makes it so dangerous. That your blood pressure can go up without you knowing. Unless, of course, you happen to go to the hospital. Your blood pressure is checked, and then they will tell you that your blood pressure is 200/120.
Yes, I've seen one.
Yes, without knowing, and that is the danger about hypertensive disorders generally. It can be there without knowing, and so therefore, women do develop this condition without knowing. So unless you happen to go to the hospital, antenatal care, the midwives check your blood pressure, and they say, hey, the blood pressure is high. Then they check your urine and say, hey, there is a protein in your urine, and so then they make your diagnosis. And that is why the frameworks of the antenatal program make sure that women go frequently to the antenatal care, so that in case some of these complications are emerging, your visit to the clinic will catch it. Having said that, there are still some symptoms and signs which can occur. One is persistent headache, frontal headache.
Where is the frontal headache? Which part?
Yes, you may wake up in the morning and you will be having persistent headache, feeling the pain more on the frontage of your head.
All right.
Yes, that is one of the symptoms. Sometimes the worst ones, you may be swollen. Your face may be swollen, your fingers may be swollen, your legs may be swollen up to the knee. And when you press it, you see that there is a depression there.
It means that when you press it, goes in.
It goes in.
It doesn't mean you're going to have a boy, right?
No, well, that is our mothers. They use these signs that it means they are going to have a boy.
Yes.
And which is not the truth. The truth is that you may be developing a complication.
Okay.
Yes. So it will be better for you. The worry that we have is that sometimes when they say come in 2 months or come in 1 month, and when the women, because this condition can develop rapidly over a period of 2 weeks.
2 weeks.
You can go to clinic today, everything is fine, but over a period of 2 weeks, your blood pressure can rise and you may start having problems.
Okay.
When that happens, the advice is that don't wait for the 1 month appointment that the midwife has given you. Just go that this morning I woke up, I'm having severe headache and I don't feel fine, so I'm coming for checkup. The midwife will not sack you, that your appointment time is not due. They will examine you, they will take you through the program, the examination, the blood pressure checks, the urine check. If everything is fine, maybe it's another reason why you're having those problems. They will find the solutions for you and then you go. But sometimes the women will say that, okay, the midwife says I should come in 1 month, so they will wait and wait. By the time the 1 month is due, they have developed severe complications. They may lose their baby and all the other complications.
Wow.
So that is the first lesson that we need to stress for the pregnant women.
Ladies and gentlemen, this is the online pregnancy school. Today we are talking about some of the complications in pregnancy, and specifically about the hypertensive disorders in pregnancy or hypertensive diseases in pregnancy. We've been given the various types. One thing doctor wants us to understand is that there is something called preeclampsia. And he's now telling us some of the signs and the symptoms that will show that we have this. And he says that you can have pain here, what they call the frontal headache. And if you went to the hospital in the morning and in the evening you have any pain, he says that go back to the hospital. Don't worry at all that when I go, the nurses will say, they will not do that. Even if it is in the night, go to the hospital and tell them that I came to the hospital this morning, but tonight I'm feeling this pain, and that is why I'm here. Now, what are the other symptoms that some women have?
Yes, so we talk about the headache, we talk about the swelling,
Yes.
and then sometimes they may feel dizzy, and that may be all. The fact that I said earlier on is that most times this is a condition that you may not have any sign or something at all, unless it becomes severe. And when it becomes severe, that you may have this headache, the dizziness, the swelling, and then your face may become puffy. And then if nothing is done, then you go on to have fits. This jerky feeling like it has as if you are an epileptic. But this is not epilepsy. Yes.
Wow. So we should not let it go to that stage, right?
Not at all, because it's highly preventable. Getting to that stage, when you get to that stage that you have a feed, you have gotten to the worst stage, and it's so dangerous for your life, for both yourself and then also for the life of the baby.
Doc, when they come to the hospital, is there something that is done for them? Let's say that somebody has a hypertension, has come to the hospital. Is there a process that they take the women through?
Yes, so the antenatal clinic process is a screening process. So all that the midwife is looking for is any problem that she will solve for you. And so everybody's blood pressure is checked. When you appear at the clinic, your blood pressure automatically will be checked, and your urine protein is also checked. So when the midwife checks these two, and he realizes that the blood pressure is high, and then there's protein in your urine, even if there's no protein in your urine and your blood pressure is high, the midwife will put you aside. He will ask you some few questions. You have headaches, he will examine you, check on the baby, and then he will call the doctor. And then when they see that the blood pressure is high, severely high, they will transfer you to the ward, where you will be admitted at the emergency room. Over there, they will give you medications to control the blood pressure. And then also, if it is very high, they will also give you some medications to prevent you from developing the fit. So these are the processes that they will take you through. And then, you know, when the condition goes to those severe forms, sometimes they will keep you on admission. They will not let you go home again. Because
for your own good,
for your own
good of
good,
the baby.
yes.
And in fact, the whole family.
For the good of the family. It is because in the hospital, then they have to be checking your blood pressure every 4 hours. But we can't get this done in the house, especially in our part of the world, where the healthcare does not really extend. In some countries, you can have health officials who can visit your house, your home, and be checking for you. But in our part of the world, we cannot rely on that. Yeah. That is difficult. And so we normally will keep you in the hospital premises. And then, depending on the severity of the condition, sooner or later we deliver you, because the condition we know that it is the pregnancy that induced it. And so the only cure eventually is for the baby to be delivered. So that is it. Yes.
Ladies and gentlemen, this is the online pregnancy school. My name is Dr. Linda Vanotu, and today we are looking at complications that can occur in pregnancy. And my guest is a consultant obstetrician gynecologist and also the medical director for the Greater Accra Regional Hospital. He is Dr. Emmanuel Srofrena. Let's visit the hospital and see what is done for these women when they go to the hospital.
May I use this this opportunity to welcome all of you to the labor ward of the Greater Accra Regional Hospital. For those women who come in labor, this is where they are first received and examined. And then when they are found to have hypertension, then further management of the condition goes on. When I said hypertension in pregnant women, I'm referring to the condition that we call preeclampsia or eclampsia, when the woman who have hypertension later on fits during pregnancy. Thank you. Follow me. Because of the condition that we call preeclampsia or hypertension in pregnancy, it's so common among pregnant women. When a pregnant woman comes in labor, one of the first things that we do is to check their blood pressures. And so as you can see, the midwife currently, the senior midwife in charge of this unit, is checking the blood pressure to be sure that the woman's blood pressure is normal. If she checks the blood pressure and it is high, there are other things that she will do. She will also check the urine protein. And when she checks the urine protein and she sees that there is protein in the urine, it gives an indication that the woman probably has that complication. Then she will take the next step. There are medications that she will give to make sure that the blood pressure comes down. There are other medications she will give to make sure that the woman will not go ahead and fit. So we call some of those medications magnesium sulfate, and then antihypertensive medications like nifedipine tablet and nifedipine protocols and so on and so forth. So that is why, and the midwives here, they have been so trained that by themselves, they detect the hypertension, they know what to do, what medications to give, what treatments they should put the patient on, what additional tests that they should do for the patient. So this is the triage unit of the labor ward. We call it the labor triage unit. Every single woman who comes here, the blood pressure is checked just to be sure that it's not coming with any underlying hypertension that will be hidden, that will give her problems during the course of the labor.
And it's the first place of contact for women in labor. When they come, we check their vital signs. As you can see, I'm checking the BP. So if the BP is more than 140, then you see that there's a problem with her. So we have to check the urine protein too and see what we will do for her. We have the BP medications that controls the BP. We have the VDP protocol. We give Nificat SMR sulfate. Even without the doctor, contacting the doctor before we do those things. So after the primary survey then we go to the secondary survey, which we do behind the screen. We do head-to-toe examination and all other examination for the woman in labor. And if the woman is not in labor and is coming for induction of labor, we do the same thing. We check the vital signs, and if the BP is above the normal, we give the BC medication that we are supposed to be giving to the pregnant women before even informing the doctor.
Yeah, so let's go on to the Obs and Gynae emergency department, where when women come with severe hypertension as an emergency, where they are admitted to. So follow me. We are now in the Obs and Gynae emergency department. Obs and Gynae emergency department. This is where most of the women who have severe hypertension in pregnancy, this is where they are kept and managed, you know. Or for those who have complications of pregnancy, this is where they are first brought to. And then the necessary management is done. When they are stabilized, then they are later delivered. That is it. For example, you see that cubicle that we label resuscitation. Those who come, whose blood pressures will be very high, who maybe they have fitted, their conditions are not good, we put them in this cubicle. Then we give them drip, we give them the emergency medicines, the things that we have to give them for them to become stable. We do all those things here, and if we have to deliver them, then we transport them from here to to the theater for operation or to the labor ward for delivery. So this is what is basically done here.
Yeah, this is the maternity ADU. When we get a case like eclampsia or pre-eclampsia, the moment the patient gets here, we admit the patient on bed. Then we take samples for such as grouping and cross-matching, FBC, BUE, LFT, and so on. Then after that, we find out from the referral letter whether he has started the MAC sulfate protocol. We have something called MAC sulfate protocol. Sometimes it depends on the BP. When the BP is very high, we start with nifedipine protocol. Yes, then after the nifedipine protocol, we continue with the MAC sulfate protocol. We bring down medicine to bring down the BP and also prevent fit. And we also checked to see whether the baby is alive. We also consider the gestational age. Yeah, if we check it, we give them the drug for the BP to come down. Then for some time, we will observe the patient for some time to see whether the BP is being controlled or not. If it is not controlled, and we look at the gestational age, whether he is about 32, 33, or there's some medicine we give to the pregnant woman to mature the fetal lungs of the baby so that we can either send the patient to theater to deliver the baby. And also sometimes we check to see whether we can induce, insert some medicine for the woman to deliver herself. So we put all those things into consideration. Yes.
Dear viewers, welcome back. Doc, thank you for taking us to the ward. Now we saw some of the things that go on at the hospital. Can you give us a little more detail as to what the midwives were doing and what the doctors also do when they said that they admit them, and this is what we have seen?
Yes.
So what happens?
So for example, when we go to labor triage, there's a unit at the Greater Accra Regional Hospital that we call labor triage.
Like we saw.
Like we saw. Now we must know that this condition can occur to you during the pregnancy, but it can also occur to you. You may be normal throughout the pregnancy, but during labor, this condition can then set in.
When you are
about to deliver.
Oh.
When you are about to deliver.
Okay.
The strange thing about this condition is that some women, it occurs to them after delivery. So it can occur during the pregnancy, during labor, and then after delivery. So therefore, when a woman comes in labor, again, we are careful to check her blood pressure and check the urine to make sure that the condition is not emerging during the labor.
Okay.
So at the labor triage unit, which I sent you, you saw that the midwives will check the blood pressure, will check the blood pressure. They have an equipment that they check the blood pressure.
Yes.
And then also they give you a bottle to go and pass urine. They will check the urine in the proteins that are in the urine. They will document it. If they are abnormal, then they will call the doctor. They will give you medication to control the blood pressure. And then they will take you to the emergency, the Obsengani emergency unit, which I also took you there to see what they do, how they will classify you. Such cases are high-risk cases. High-risk cases. And so the midwives will put them closer to their station. And then those who don't have any problem, they are the ones that are sent to the other side of the ward.
So it's a whole process.
It is a whole process.
And as you saw, ladies and gentlemen, there is a system in place.
Yeah.
They triage you, which means that they check and see where they should place you. Is this one an emergency that we should do something about quickly? Or this patient or this woman can be put to the bed and let her wait and be examined and be observed. So it's a whole process that you
It is indeed a whole process.
You don't have to wait. Please, don't wait at all. And you can only have these services when you take antenatal seriously and you also follow instructions that are given you at the hospital. Distinguished ladies and gentlemen, this is the online pregnancy school. My name is Dr. Linda Vanutu, and we are talking about complications that can occur or may occur during pregnancy. My guest for today is a consultant obstetrician gynecologist, also the medical chief executive for the Greater Accra Regional Hospital, Dr. Emmanuel Stroffen. Doc.
Yes, one important thing that we have not, that I need to stress, is that rapidly this condition is becoming a leading cause of death in Ghana. when you look at the statistics, bleeding, after bleeding, like women who deliver, they bleed, those are the major causes of hemorrhage, of death in Ghana. But now, this condition is becoming more and more, it's coming up more.
Why?
The reason is difficult to really establish, but one thing is that now we have blood available.
Okay.
We are managing pregnant women who need blood, we are managing them better. But because women don't still come up early, so the preeclampsia is like we still don't have control. Even though we have medicines that we can prevent the fit and the other complications, unless the woman comes to the hospital early. If the woman comes late, you can have all these medications, but it will still not benefit the woman.
Yeah.
And so now when you go to Kolebu Teaching Hospital, the Greater Accra Regional Hospital, Componenti Teaching Hospital, the bigger hospital,
Yes.
this has become the leading cause of death.
The leading cause, which is preventable.
Which is very highly preventable. It causes maternal mortality and also stillbirth, perinatal mortality.
Unfortunately.
Unfortunately. And this is what we don't want. This is, the government have programs in place in order to protect the life of the women. But we need the cooperation of the women themselves.
And the husband.
And the husbands. Sorry, actually, the cooperation of the husbands and then the women.
Yeah. Doc,
Yes.
what are the complications of this preeclampsia?
Thank you so much. So the main complications of this condition, first of all, the one that can affect the brain, that is what I spoke about, that can lead to the eclampsia. So, number two, still in the brain, it can let some of your blood vessels burst because the pressure on the vessel has gone too high.
Yeah.
The blood vessel can burst and you can have stroke. What we call stroke, it can happen to you. And then coming back to the heart, it can let the heart fail because the pressure is too much. It's the heart that pumps the blood. So if the pressure in the system is too much, the heart can fail. It can also affect your lungs. It can affect the liver. So the liver can become swollen and then fail in its functions. It can also damage the kidneys. So your kidneys will not work well. Some people may have severe forms, so severe that by the time they recover, their kidneys never recover. So they end up having a chronic kidney disease. Yes. So the fact of the matter is that we call this disease the disease of the systems. No system in the body is left untouched. When you have
preeclampsia.
When you have the severe form of preeclampsia, almost all your systems in the body, all your major organs are affected in one way or the other.
Okay.
It also affects the placenta, the functioning of the placenta.
Yeah.
So the baby, because the placenta is the organ that transfers food and oxygen to the baby and carries carbon dioxide away from the baby to the mother for the mother to excrete. And so if the placenta doesn't function well, the baby is not going to grow well. Yes, so this is also one of the complications. So it can affect the placenta and then the baby will not grow well. And in some cases, the baby may even die also in the womb.
While still in the womb.
While still in the womb. Sometimes the placenta, the functions of the placenta are so affected that it can even prematurely separate from the mother. Normally, with deliver, you have to deliver before the after birth separates and come out. But because of this condition, if it is severe and attention is not paid, it can cause the placenta to prematurely separate from the woman.
Before the baby is born.
Yes, and in that case the baby will die. Because the placenta that keeps the baby alive.
Yes.
So these are the dangers. And when that happens, it's not only the baby who is in danger, the mom is also in danger because it causes severe complications. So indeed, every organ of the body experiences some problem in one way or the other.
Yeah.
Even your eye can be affected. Vision, your vision can be affected.
So it means from head to toe.
From the head, the brain, the eyes, the throat, your larynxes can cause laryngeal edema or edema of your windpipe.
That's swelling.
Yeah, your windpipe can swell up so that you find it difficult to breathe, or when you are breathing, you'll be creating some sounds. And people will take it that, oh, this is normal in pregnancy. Please, when you experience those things in the house, go to the hospital.
Yes.
It may be a telltale sign that something is happening. So, from the head, the eyes can be affected, the throat, the windpipe can be affected, your lungs, your heart, your kidneys, your liver. and then the placenta, the baby. All these systems can be affected by
And you
this
can also have a stroke in addition to
You can
that.
even have a stroke in addition. It can permanently damage your kidneys. You know the kidney God gave us only two.
Yes.
And so when they get damaged, that is it.
There's nothing.
There is nothing you can do. They will say you have to undergo dialysis for the rest of your life. And that is something that is not pleasant.
And it's not cheap.
And it's not cheap. So if there is anything we can do to prevent these complications, then it's better for us to go. We are not putting fear in people not to get pregnant, because that is the only way we can reproduce the population.
Yeah.
But then we need to take pregnancy seriously. That when you achieve pregnancy, it is a serious thing that you must have time and pay attention to your body and follow the rules and the regulations that they say you should come for antenatal. When the midwife give you the deed, you have to abide by it.
Yeah.
Sometimes the midwife will give you appointment and people will not go.
They will not go.
They say their husbands have gone to trek.
But when the husband was sleeping, he didn't carry the pregnancy away. The pregnancy was still with you.
Yes.
Dear
There was
viewers,
one.
please.
There was one unfortunate situation where the woman was having a problem throughout the night. That is why I like the caution you gave. Even when you go to the clinic in the morning, by evening you're having a problem.
Go back.
Don't wait for the next day. This woman, I always remember her. She went to the clinic according to the records in the morning, and her blood pressure was normal. But in the night, she was having severe headaches. So instead of coming back, they waited till the daybreak.
Oh.
In the morning, they now went to the clinic where they went. When they went, her blood pressure was high. And then when they referred her, she went back to the home to tell her husband that I have been referred to Reiki. And then now they have to mobilize themselves. So having to mobilize themselves, she started fitting. Now she has developed the worst form before they came. So that was a very bad situation. By the grace of God, she survived. Yes. But that was a dangerous, it was a risky behavior that they carried out.
Dear viewers, this is the online pregnancy school, and we are listening to a colleague who is an obstetrician, gynecologist, a consultant at that, and he's also the medical director for the Greater Accra Regional Hospital, Dr. Emmanuel Srofeno. He has seen so many pregnant women. He has a lot of experience with pregnant women, and that is why when he's telling us that we should go to the antenatal when we are asked to go, please do that. The disease can come, but we have the structures in place to help you. So please, please, please don't stay at home. If you go to the hospital and you even get home and you find that there's something wrong, just go back. And for the men, because the women love you so much, they want you to tell them to go to the hospital before they go. So please, show interest. When the woman goes to the hospital for antenatal and comes back, ask what is wrong. Ask whether everything is okay. Ask whether she was told to do something so that you can support her. And through this education, our hope is that we'll be able to reduce maternal mortality and also reduce childhood deaths. Look, so these things happen to the woman. What about the baby? How will she know that the baby is not well? So she has to go to the hospital.
Okay, so the woman herself may have some signs and symptoms like the persistent headache that I spoke about. But as far as the baby is concerned, the only sign that the woman may feel is that she may feel that the baby's movement had reduced. So that is why we also educate the women, and these days we even have a chart. Sometimes for the high-risk women that we give them the chart. That when you are there and you feel that the baby is not kicking the way it used to kick, do not wait for the next Monday or your next appointment. Just go to the hospital. It could be that something is happening to the baby. It could also be that it's the preeclampsia that is affecting the baby. So when you go, it will save the baby's life and also save your own life. So as far as the baby is concerned, another sign could be that the baby may not be growing well. You know, when you go to the hospital, the midwives measure the size of the abdomen, and then they compare it with the age of the pregnancy. And we are always comparing. When we see that the baby's growth is falling behind, it's a sign that the placenta is not functioning well to feed the baby. The placenta feeds the baby. It's a sign that the placenta may not be functioning well. And that will also be a sign of some preeclampsia. It could be some people, the blood pressure may not be so high, but the disease is still underneath, causing problems.
Okay.
So we look for both sides, both the baby and also the mother.
Okay. Thank you very much. No, now somebody will be wondering, hey, then if I have this, it means I'm gone. Well, is there something that can be done for them? What is the treatment? Is there any treatment?
Oh yes, there is treatment.
Yes.
As I said, it's a hypertensive disorder. So the first thing we do is that we give you medications to control the blood pressure. And those who have the severe forms, we give them another medicine which will prevent them from fitting. And then we'll make sure that all your organ systems are stabilized. And at the right time, we deliver the baby and remove the placenta so that you'll be free. Gradually, your blood pressure comes back to normal. This is what we do. But during the antenatal period, some of the new systems we are putting in place, we want every pregnant woman to have a midwife so that it will make communication better. Because some of the people, maybe they stay far away, they are not sure.
Yes.
But you can call it midwife. You can call it midwife. The midwife, today I was there to see you, but this evening my head is paining me. The midwife advice you report to the emergency.
Yes.
Because they want somebody that they can talk to directly.
Exactly.
Yes. And so right now, when you come, we allocate you to a midwife. And when you come anytime, that's the midwife you will see. So that you become accustomed and used to that midwife. You know the midwife also knows you. So you have a relationship.
Yes.
You exchange numbers. You can call her anytime or send her a WhatsApp message that, oh, I have this problem. Then she will respond to you and advise you what to do. So that's one of the systems that we put in place.
Good. Doc, I know that there's also another system where there's a link. So if I'm not attending a clinic at Ridge, but I go to another hospital, there is a system in place, right? Even on the WhatsApp.
Yes.
Where if I go to a particular hospital, they can talk to you, that is Ridge, or to you, or to any of the other people. Can you tell us a little about that?
Okay, so those systems are still there, where we have linked all the hospitals that work with Ridge. We link all of them together on a WhatsApp platform. So anytime, if you report to your hospital and they see that you have a serious condition, like your blood pressure is so high that they can't handle, they will just put your information on the WhatsApp platform. And that platform, the doctors on duty at Ridge, they are always monitoring the platform. And so they will look at it and they will say that, look, come to Ridge.
Yes.
They will tell the midwife to transfer you to Ridge. And so by the time you get to Ridge, we are ready for you. We have set up a bed for you, the drugs, the drips, everything is ready, and then we just manage you. So that system is also there. Some of the clinics also put the women who register in that clinic on a WhatsApp platform so that they can directly share their experiences.
Yeah.
Yes. Wanda has such a system in place at Ridge where the pregnant women are also on the platform. Those who have delivered, they still stay on the platform to encourage the new ones who are joining. All those systems are in place. Pregnancy should be fun.
It should be.
Yes.
Pregnancy should be fun. Ladies and gentlemen, this is the online pregnancy school, and that is what we always say. That it should not be a time of anxiety. Pregnancy should be a time of joy. And that is why the doctors are available for you. You see, the things that they have put in place, they have a platform. In fact, yesterday, around 10, after 10 p.m., one particular facility was talking on this platform about a woman who was there and needed support. And I was very happy to see that they said, bring her to Ridge.
Yes.
That is very interesting. Please, if you are listening to us, if you are watching us, if you are pregnant or you know anybody who is pregnant, tell them that there are so many systems in place to support you to let pregnancy be a time of joy and not a time of anxiety. Today, our topic is hypertension in pregnancy, and my guest is Dr. Emmanuel Strofenyo, a consultant obstetrician gynecologist and also the medical director for the Greater Accra Regional Hospital, Ridge. My name is Dr. Linda Vanutu. This program is sponsored by Promise, Vanutu International, Reverse Tap, and Samsara Ventures, manufacturers of Double Gold Liquid Soup. Doc, what advice do you have for the general public?
Thank you very much. some few advices that we'll have is that, first of all, for those who have their personal BP machine, there are some women, I know not every woman can have. I've had patients that they themselves monitor at home. When they come to the hospital, we monitor for them. But when they go home, they will monitor their own BP and they send you the value. They will write it and then they will send you the value. And then we monitor, especially those who have had it in the past. We become very conscious of their BP, so they also check. Now, even if you don't have that, from time to time, if there is a nearby pharmacy, just go pass there and check your blood pressure. The midwife may have told you that come back in 2 weeks. But from time to time, maybe Sunday afternoons you are there, you are bored, just go to the nearby, let them check. So that is the first thing, frequent checking of the blood pressure. And then the second advice is that if you have had it before, or if you have any of the risk factors that I mentioned, maybe previous history, or a family history, your sister, your mom, or your grandma have had this condition, then when you go to the hospital, tell the midwife. Tell the midwife that you have had this hypertension or preeclampsia disease. You have it in your family, or you yourself, you have had it in your first and second pregnancy. The midwife may ask you, but even if she forgets to ask you, tell her that you have had this preeclampsia condition before. Then she will write it down with red pen that this will have happened before. We call those people high-risk cases. So when we classify you, there are medications we can even give you in the bigger hospitals. There are medications that we can even give you to prevent the condition from coming. So once the doctors are sure that yes, you have had this type and you are at risk, those medications are available. They are very cheap. The doctors can prescribe it, and then you will get it, and then you will be taking it on a daily basis, and you will never get the preeclampsia. So this one is prophylaxis. This is the prophylactic approach. That's another important information that the public needs. Again, when we talk about preeclampsia, it's one of those conditions that the importance of birth preparedness and complication rate becomes so important. These concepts become so important. It cannot be that when the complications set in before you start organizing yourself. So if it is money, or if it's a taxi driver that you should collect his telephone number, a local taxi driver that you should have his telephone number, so that in case in the worst scenario in the night, you have to rush to the hospital. Maybe your husband is not there. The taxi can even take you on credit. If your husband is not there, and you call, you arrange with him that I'm pregnant. In case there is any problem in the night, I will call on you. He can always take you without payment, and your husband can come and settle. So those people who stay in the house with the excuse that my husband is not in,
he didn't carry the pregnancy away.
Those excuses, we can no more accept them. We can no more accept those excuses. So these are some of the things. And then when the midwife advises that, or maybe the doctors want to admit you, sometimes, let me share some experiences from the ward. A woman's blood pressure is so high, and you want to keep her on admission, control the blood pressure, and then give some medication so that you can deliver. Number one, the woman will say that she has other children in the house, but she will not like to be on admission. So sometimes they will forcefully, sometimes they will even write a note, discharge against advice. I don't want to be in the hospital. They want to go home. And it makes it so difficult because we know that what the woman wants to impact upon is dangerous to her life and the life of the baby. So that is one thing that I'm sharing with the public, for us to know that the doctor cannot make any decision in your worst interest. It is only in the interest of the mother and the baby. Because in the hospital, you can guarantee that every 4 hours, the nurses will come and check your blood pressure. But when you go home, what is the guarantee? And we have experienced this one over and over again. Sometimes too, because I said earlier on that the only cure is to deliver the woman, for the baby and the placenta to come out. That is the only way. Sometimes too, the women will refuse. They refuse the delivery. They say the pregnancy is not 9 months, so they will not allow the doctor to deliver them. That is another excuse that they give. So again, makes our work so difficult. Because you cannot compel a woman to go and deliver her. She has to cooperate with you before you can deliver. These are practical things that we have experienced on the job. That sometimes.
So she wants the pregnancy to go to 9 months.
To the 9 months. Meanwhile, her blood pressure is so high that the doctors and the midwives are afraid. And she is not afraid. Because she may not be having serious symptoms.
Yes.
That is what I said about this condition. That you may have it without it showing you any serious signs and symptoms. That is the danger with hypertension. Even for men on the street, some of them are walking about with severe hypertension. And they don't know. They don't know. And then one day, and then it strikes them down. For me, this is one key lesson we should take.
Ladies and gentlemen, this is the online pregnancy school, and today my guest is Dr. Emmanuel Stroffenor, a consultant obstetrician gynecologist. He wants us to know the term pre-eclampsia. Everybody, a man, a woman, pregnant, not pregnant, you should know about it. He's giving us some of the things that will show you that there is something wrong. The headache, the eye. You know, one day a woman went to the hospital and she was going to the eye clinic because she said she had problems with the eye. Then fortunately for her, by God's grace, somebody asked, "Mommy, where are you going?" She said, "Oh, I'm going to the eye clinic because I have this eye problem." She said, "Because you are pregnant, let us check your blood pressure." And lo and behold, it was very high. So that is telling you that it can show and you will not know about it. That's why we are doing this program, so you know that there is something called pre-eclampsia. Please learn that word. We don't want it to go on. If you haven't taken any word from his discussion, he says that take that word. We don't want it to go on to become eclampsia. We don't want that one, because from head to toe, he has told you some of the complications that can happen. Some of them are irreversible. You cannot reverse them. And these are all preventable. I hope you have learned a lot today. If you have any questions, don't hesitate at all. Just send me a WhatsApp message on 059 242 0625. 059 242 0625. Dr. Stroffenor is a consultant obstetrician gynecologist, and he works with so many doctors. Some of them you have already seen on this program. They are working together to ensure that pregnancy does not become a time of anxiety. What we want to achieve is that women will become pregnant, they will go through pregnancy successfully and have healthy babies whilst they also stay healthy. Look, I want to say a very big thank you to you. Then do you have any last words for the pregnant woman herself?
Yeah, my last word is that the pregnant woman to take her life into her own. That she has the power, and that power is generated from knowledge. So pregnant women must seek knowledge for themselves. They should get books to read, and they should follow positive programs like the online pregnancy school program, so that at the end of the day they empower themselves with knowledge, and the knowledge will set them free. Thank you so much.
Thank you. To knowledge will set you free. That is why we are bringing you this. We hope you have learned a lot. Please share with friends. Visit my Facebook, Dr. Linda Vanotu, and you get to know all that we have discussed, all about pregnancy, to ensure that pregnancy becomes a time of joy for you. On behalf of the viewers, Doc, we want to thank you for taking time off your very busy schedule to be with us. Let us all learn to stay healthy. Please remember, wash your hands, wear your mask, and keep the social distancing. See you another time. Bye.